We placed a feather against the air outlet of this homemade ventilator, this indicating that air was actually being pushed through the vent at a frequency similar to the normal breathing cycle of a human. Samuel Kairu, the brainchild of this homemade ventilator, says he realized how every country was grappling with the search of ventilators to save its people. Due to the corona pandemic, patients in critical conditions must be put on ventilators to support respiratory systems in their recovery process.
We wanted to show that a simple ventilator can be made using local parts, to show that concept of being able to give a patient some breathing aid.
This is his ventilator. Samuel used locally available parts to develop his machine.
Existing ventilators in the market are very expensive, costing 3 million to 5 million shillings. So those are out of reach, and they're also not being exported because of the shortage, and the disease has ravaged Europe and North America. So we have to come up with a solution that we can be able to do it here.
But his idea could not kick any further since he did not have any mechanical knowledge on how to develop it.
So we have a working prototype now that is able to mimic breathing. It has a piston that presses on an ambu bag that can be able to deliver air to the patient.
He later called in a doctor who uses ventilators in a hospital environment to help him know how his ventilator can save a life without fail.
The basic movements that I am seeing there, they're making sense. That's what I do when I press the ambu bag. The ambu bag that's being used here is tested by the Federal Drug Authority in America. I mean, it's the thing that we use internationally. And so it's about now, if we discuss, all of us, based on the different expertise that we have, would we be able to refine it to a level where we can produce the pressures, the volume, and the frequencies that I'm discussing, as well as having fail-safe mechanisms.
The three now sourced for a motor vehicle wiper motor and a car battery.
I settled on a wiper motor because I have used the wiper motor in another place, in another my own project of mine. So I knew it's a very, very reliable motor. Actually, the motor has a life of it's supposed to deliver, when attached on a vehicle, it's supposed to deliver 1.5 million wipes. That means 1.5 million. So you can literally drive for a month with your wipers on, even in snow, and the wiper will not burn.
But a motor and a car battery alone could not complete the task. They had to look for an original ambu bag, commonly used in a normal medical ventilator.
We teamed up with a doctor friend of mine, Dr. Derito. Dr. Derito is advising us on the practicalities of a patient breathing mechanism and how the responsive the ventilator we make has to be to respond to the patient.
Even though this home ventilator can work on an ideal situation where a patient needs respiratory support, according to the doctor, the machine needs a computer program to control the speed, pressure level, and amount of air a patient gets depending on their condition.
As a doctor, I have to see in the monitor what's really happening in my patient. And I need to be very confident that the figures I'm seeing on that monitor are the accurate readings of what the pressure, the oxygen concentration, the volume, and the frequencies that are actually going into the patient, so that I can adjust on the machine what I really need.
All the items used on this homemade ventilator were obtained locally and cheaply. Samuel believes, given a chance, he can produce them in mass after making a few cosmetic adjustments to the carrier box.
We want to be able to come up with a plan so that we can be able to make massive amounts of these ventilators in a very short time, because they are needed. If the disease, right now we have 120 plus cases here in Kenya. If the disease numbers go above 1,000, we need 200 people. 200 people might need ventilators. If you have 10,000, we might need 2,000 ventilators.
Every country is considering how the ventilators can be manufactured locally to reduce expenses and have them supplied faster to the much-needed healthcare system against COVID-19. As the world races against time in search and production of medical ventilators, one man in Kenya believes he can help the country search no more. He can do this locally. Dennis Matara, K24, Nairobi.